Hello, my name is Manon Kaiser. I am a young Gashsteiner and advocacy officer for the Global Health NGO DSW. You are Natasha Azzopardi-Muscat, Director Health Systems at the WHO Regional Office for Europe. Thank you for joining us, Natasha. You moderated the first session of the European Health Forum Gastein, Women's Health 2030, Closing the Gender Health Gap. We know that women's health is a field that is critically understudied and underfunded. As a medical doctor and given your position, can you give us recommendation on how to put this issue at the forefront of the political and research agendas?
Thank you, Manon. Indeed, it was great to moderate that session. And I think we heard very clearly that there are still struggles in getting women to be represented, even in clinical trials, as well as to get the right interest and incentives for women's health issues to be researched and then eventually lead to the funding and development of the products that are needed to address these gaps in women's health. We spoke, for example, about particularly relevant to the European region, the aging population of women and the needs to address their health needs even around, for example, the time of menopause, endometriosis, polycystic ovaries, all of these were brought up. But beyond that also we know that cardiovascular disease presents differently in women, and the way in which women also respond to disease and are able to live as survivors also with, for example, cancer and other conditions. It's not just the physical biomarkers, but it's also the whole quality of life. So absolutely, we at WHO will continue to advocate for the promotion of research on women's health, on sexual and reproductive health, on mental health, and on health issues which are important to the global burden of disease more generally, including, for example, dementia, which again is a significant problem for the very old women in our societies.
It is great to hear. But the specific title of the session was Women's Health 2030, referring to the Sustainable Development Goals, where in 2025, 2030 is just around the corner. So from your perspective, what are some of the biggest gaps you see in ensuring equitable access for quality healthcare and services for women? And how do we also take on a post-2030 horizon with this issue?
So this is going to be extremely challenging. Let me be clear. When the Sustainable Development Goals were negotiated, the world was a very different place. And I think we are going to be rather shocked when it comes to the negotiations of what is going to come post-2030. Having said that, we need also to be optimistic and look at what can be done. And for example, the Declaration on Universal Health Coverage for Health Systems showed that it's important to focus on primary healthcare, on access also to sexual and reproductive health services within the context of primary healthcare. To me, quite frankly, if you were to ask me what are the priority focus areas post-2030, what I am seeing definitely in the European region is the mental health of young girls, the rate of anxiety, depression, eating disorders, also body dysmorphia coming up as an issue that was definitely not on the agenda when the Sustainable Development Goals were negotiated. But we also need to think more broadly in terms of access to good quality health and long-term care, particularly for those women, for example, who don't have an adequate income because they don't work long enough to then get a decent pension in later years of life.
Yes, absolutely. That is a critical issue. And to loop back to the SDGs, so SDG 5 is dedicated to gender equality and empowering women. So we're also witnessing, unfortunately, a global backlash against women's rights. And according to a 2024 survey by the EU Fundamental Rights Agency and the European Institute for Gender Equality, 1 in 3 women in Europe has experienced violence at home, in public, or at work. It is a critical public health issue, and how do you make the link between women's health, public health, and violence against women and girls?
Thank you for this question. And I'm really pleased to share with you that in our upcoming European program of work, our regional director, Dr. Hans Kluge, who is a man and the father of 2 young girls, was alarmed by this statistic and decided to make violence against women and girls what we call a special initiative of the regional director. As a result, a few weeks from now, to coincide with the 16 days of activism in November, we will be releasing a report that brings very clearly into focus the role of the health sector in preventing and responding to violence against women and girls. Many times the health sector is the first and only point of contact, and we need to do far better at providing the right policy environment, but also supporting healthcare professionals to be able to inquire, to be able to alert, and to be able to work with survivors to guide them to be referred to the right services that are provided with privacy, with confidentiality, and with safety. So we want to bring into the spotlight the role of the health sector in preventing and responding to this scourge of violence against women and girls.
That's a great initiative, and that's very exciting to hear about this. And it allows me to ask you a question that is slightly different, but when we talk about women's health, one factor also is menstrual poverty and period poverty, and it's a very widespread issue. And I was wondering if you had any recommendation on how to tackle this. Also, with your very regional overview, maybe you can share some good practices from different countries on accommodating women's health, for example, whether it's with menstrual leave, making period products very accessible or affordable, or other kind of psychosocial support for women?
Thank you. No, indeed. I mean, this is an issue that has, on a positive note, I would say, been getting more and more attention. And of course, we advocate, for example, for wherever possible, taxes to be removed. So a number of countries, Malta, Cyprus, Ireland, for example, in our region, have taken steps to remove, or even in Germany, reduce VAT on such products. So, I mean, maybe it's a small step, but it's a step in the right direction. Making these products also accessible and available, for example, in schools, could also be an important initiative, because it links to the stigma that still exists around, for example, menstruation, around period pain, and the inability sometimes of young people, young women, to speak out and to feel that they can be believed and supported. So absolutely yes, these are all steps in the right direction. And I would add that our work on the financial protection and out-of-pocket payments carried out by the Barcelona office also shows, of course, that it's not only medicines and medical products that tend to drive these out-of-pocket payments. And typically it's always the people who are in the bottom income quintiles who are most adversely affected. So countries can also look at ways of supporting people who are most at risk of poverty.
That's a good recommendation. I hope it will be taken up. The theme of this year's session is rethinking solidarity. We've talked a lot about a challenging geopolitical environment, and especially recently with massive cuts to humanitarian and development aid, notably coming from the United States, which was a really big funder. How can we make women's health a true priority, and how can the EU step up instead to strengthen solidarity? I think this was a quote from the women's panel. The EU needs to step up where the other have stepped down.
So of course it's easy to say that, but the EU is also facing its own constraints, and we know it. But absolutely, overseas development aid has been cut. It's most visible because, for example, the US has withdrawn from WHO, and a number of other sister UN agencies have also been affected. So we are internally, as part of the UN80 process, trying to find ways to partner better so that with our scarce resources we can do more, because the humanitarian needs just keep growing and just keep rising. In this context, I would like to shine a light on the fact that supporting women, even in conflict zones, for example, has been a focus of our activities. Supporting women and protecting women against violence, even when they are fleeing conflict zones and end up as refugees in other countries. We have been doing a lot of work with countries that received, particularly in 2022, a wave of refugees from Ukraine, who typically were mostly women with children. And this needs to remain on our spotlight. So when the EU is talking about building resilience, when the EU is talking about preparedness, when the EU is talking about security, we need to make sure that the safety and protection of women is part and parcel of those discussions. Beyond that, however, I see that the EU prides itself as having been a front runner, really promoting and safeguarding women's health as well as sexual and reproductive health and rights. And we hope as WHO that we can continue to count on the support from the EU, both as WHO Euro and in their global health strategy, to continue to champion this area. And I understand that we will be able to see this in the months and years to come, and I hope that we will be able also to ensure that the EU and the Euro region in general continues to be a front runner. And I can share that as part of the European program of work, continuing our advocacy in this area, making sure that sexual and reproductive health is an intrinsic component of universal health coverage, will remain a key priority, critical focus for us. Thank you.
Absolutely, as you say, it's very critical. I have one last question for you. You, in the context of the session on women's health, you asked the question, why do we need a panel on women's health, right? So we know why, but what is your hope for the future? Do you hope that we won't need to have a panel on women's health at all? Or do you hope that we can have a panel on this topic discussing progress instead of the gaps?
So in the session I said that I am still asked, why do we need a session on women's health? I would like to say that as WHO, when a few years back we published our women's health strategy, we also published a men's health strategy. And when we look particularly nowadays, even at our younger generation, and we start analyzing the results that come out of the health behavior of school children, HBSC survey, you can see really different patterns emerging. Remember, we surveyed these children at the age of 11, 13 and 15. And you can start to see these patterns emerging when you look at the gap, the gender gap at age 11, the gender gap at age 15, the difference is there. So it's not that men don't have their own health needs. They die young, they commit suicide sadly, but it's about being gender aware and ensuring that our data is gender disaggregated and that our responses are gender responsive.
Sounds great. Thank you so much for this interview and for your time.
Thank you.